Public health isn't just a department at the county. Public health is what we eat, it's what we drink, it's what we do, it's our safety, it's all around us, and it involves everyone. It's not just a certain level of people, it's not just people who are on medical assistance, let's say, or reach a certain poverty level. It's everyone in the county.
Sauk County Public Health. Working for you, working for me, working for all of us.
The Public Health Department has approximately 30 employees, and we cover 4 major programs. We have public health nursing, and in public health nursing we provide immunizations, we do communicable disease, we have prenatal care coordination, maternal child health nursing, we do preparedness. We have to be prepared for outbreaks, we have to be able to go in and vaccinate if we need to. I could talk about the home care program. We are Medicare certified, so we have to meet all the guidelines for Medicare, and then we're also state certified.
The home care program is something where it's a service that really maximizes people's ability, if they're going through a healthcare challenge, to be at home. And if you ask most people, where would you rather be? Most people would say, I feel most comfortable at home. And if you can help develop a plan with a physician, so a physician obviously has to give you orders, work with them on a plan that's safe for them to remain at home and maximize their independence so that they, I think, heal faster and feel better about themselves and their situation. That's what home care does. We have our own little staff, and it happens to be 3 registered nurses and 3 certified nursing assistants, and then we contract with therapists. So it's for people that need physical therapy, occupational therapy, speech therapy. So it's skilled services that we provide, and basically we get referrals from local hospitals, from local clinics, from assisted livings, different places, and it can be anything. You know, we check insurance obviously, but we get referrals from institutions where people don't have any kind of insurance, and then we go to work to come up with a care plan that's fiscally responsible, obviously, because we want to be cost effective. We don't have tax levy support, so I mean we need basically enough people that have insurance to counterbalance the people that we help that don't have insurance. And that has been one thing that our Board of Health has been very strong about, is the fact that we need to be there to service the people that are the most vulnerable at a time in their life when they need a helping hand. And I think we're there to do that. I'm really proud of the fact that we've never turned anyone away that's needed home care. We've been there for everybody. And I worry if we weren't here, would the privates do it? When I call them and ask, please, their response to me has always been, oh, that's a lot of care, and they live way down in Spring Green, and if we use all our charitable dollars up with that one, we won't be able to do it. So when they've helped me out, they've gone in for 1 or 2 visits and then pulled out and left the person just alone with nothing. And based on what I've seen when I've called around to see if other people would help, the answer to me has been no. If we weren't here, I like to think that someone would step in, but based on the track record that I've seen, if it's not us, I don't think they would. When it's somebody with no insurance, who do people call? I know who they call. They call us, because they know that if somebody needs help and they don't have insurance, we will come up with a plan and work with a person in order to get them the care that we need. We do it.
The environmental health program has grown over the years. It started with Sauk and Adams and Juneau County pooling their prevention dollars, and then we hired 1 environmental health specialist. We are by statute required to deal with health hazards and write abatement orders.
We're contracted by the DNR to do water sampling at TN systems throughout the county. TN systems are basically systems that aren't on municipal water but yet feed the public. We have a contract with Department of Health Services for doing inspections on like hotels, campgrounds, some smaller complexity restaurants. So we're out doing inspections at facilities for operators. We've got a lead program, we've got a rabies program where we do monitoring of any bites or possible rabies infections. We also do a radon program where we sell radon kits and help with any mitigation or testing follow-up that's necessary. We also do a nuisance complaint ordinance, so if there's any like junk complaints or neighbor complaints or housing complaints or just general sanitation complaints, we do follow up that and work with other departments in the county and make sure that things are taken care of.
We provide immunizations at our foot clinic program, very popular program. Between 1,500 and 1,700 people a year come through that program. We have prenatal care coordination,
which is really kind of neat because people can come in for a free pregnancy test, and that can be part of our program too. And depending on the results of the test, we either talk to women about family planning and what they're going to do next if it's negative, or if it's positive, we can get them enrolled in, it's called Express Enrollment, and what that is a temporary Badger Care card for pregnancy only. And that allows the woman to get into pregnancy care right away. It also pays for prenatal vitamins. She can get her ultrasound and the first major doctor's appointment, and takes effect immediately for about a month. And then they have to apply for full coverage Badger Care. And when they're on the program, then we admit them to PNCC. Also with PNCC, we can refer them to WIC, which is nutrition for pregnant women and babies. We can pay for childbirth classes. And we follow the woman throughout the pregnancy, at least one contact a month. And when she has the baby, then we make at least one visit postpartum to see the baby and refer them on to further programs if they need it. We really screen to make sure that parents understand about safe sleep and that they have a safe crib and a safe car seat. Safety is a big thing with our program. Also with healthy habits during pregnancy, to avoid drinking and drugs and to quit smoking. The goals of the program are to have the mom have a healthy pregnancy, have a healthy baby, and to reduce the rate of prematurity and reduce the rate of low birth weight. It's wonderful to see the light come on when you're talking to someone and educating them and referring them to resources and programs, that they know that there's someone they can turn to if they have further questions or problems or they need something.
Then we also have our WIC program, which is the Women, Infants, and Children's Nutrition Program, and that is a federally funded grant program. Right now, our caseload in that program is over 1,400. The goal of the program is to have good birth outcomes in there and to have healthy children and mothers and breastfeeding mothers. Breastfeeding is one of their biggest things. We all know in public health, well, in the medical community, that breastfeeding is the best nutritionally for an infant.
The WIC program is an income eligible program, so they would need to show us proof of income, and the income guidelines are 185% of the poverty level. And many people are quite surprised that our guidelines are a little bit higher than what some of the other programs that are out there. And the majority of all of our families, probably at least 95% of all of our families, are working families. We do get a set amount of dollars based on how many clients that we serve. So if we aren't serving the set amount of clients, we will actually lose some of our federal funds. And we are fully federally funded. None of our funds are from state or local. For every dollar that WIC spends on a pregnant woman, tends to save about $4.21 in Badger Care costs, because WIC is a big promoter in preventing prematurity and low birth weight babies, so that in turn saves Badger Care costs. One of the big things is all of the checks that they get with the certain foods on them. Those checks are spent here in Sauk County, And I get a report every, like yearly or monthly, and I can see how many dollars are spent in all of the grocery stores. And in 2011, there was almost $1 million that were spent using WIC checks just within the grocery stores within Sauk County.
And everything that is done in the health department, we have to remember, is generally based on some kind of data that has been evaluated.
There are state statutes that say every county public health organization needs to do this every 5 years. So last year, 2011, was our time to do a needs assessment. And we identified 4 areas that we really want to target. And those were chronic disease, that can be, it's a big thing when you say chronic disease, but I guess the big ones are diabetes right now and probably congestive heart failure. So I think those 2 are probably the top. So it was chronic disease, it was lack of physical activity, lack of access to dental care for everyone, for every county constituent, and then also alcohol and drug abuse. And the underlying philosophy in a public health department, it's prevention, and prevention is a tough sell. It's a tough sell because basically you're asking people to look into the future and say, if you don't do these things, if you don't eat the right foods, if you don't get exercise on a regular basis, you might down the line have this. And let's face it, federal and state government, all we're talking about is how expensive health care is. Well, if we don't change some of those patterns, in our kids and in the younger population, I think we're going to be in big trouble. And I think people have identified that.
I think in the past, public health was always considered that's where you go to get your immunizations, and that was always true. And then now, the private providers and health insurance pay for immunizations and do all that. But people still have that perception that public health is about immunizations. And we are to an extent, because we want to assure that everyone is immunized. I don't think people understand our role as far as how we relate to the private sector and how much we work with the private sector. And then also, how do we work within the county to help provide services. So the scope is huge of what the health department does.
Sauk County Public Health works for you, works for me, works for all of us.
I love PNCC. That's how I get my OB fix. Especially that postpartum visit where I get to go and sit at the house and hold the baby and give mom a little break and we talk and I'm holding baby and
that's our passion, just seeing these babies and these children. It's just a wonderful, wonderful career.
The look on their face, the thanks they give you when you have a healthy baby, that's so rewarding.
It's a family. If someone needs help, there's always somebody there to chip in and offer help. It's a rewarding place to work.
They do care about the health department. They care about the people. They care about the quality of services. We care about each other, and I think that is so important to get a group of people to work together as a team, is to have that caring attitude.
But yeah, I do enjoy the inspection-based part of my job. I enjoy working with these people here. These guys, the 2 guys, Justin and Matt, they're great. The nurses are great, and the administrative staff is great. So, I couldn't be luckier, I guess.
We are a pretty dedicated group of individuals that really do care tremendously, really, about the needs of our community members.
I love what I do. I really feel that what we do in public health makes a huge difference in some of these kids' lives. So It's very rewarding for me.
I really like the lead program, mainly because you get to see results right away when you're working with children and working with their families. I think one of the things that people overlook a lot with our department is we're not reactive, we're proactive. So we do a lot of behind the scenes work. So you don't see people getting sick because we're out there actually doing the inspections and making sure that people are handling the food correctly.
I really enjoy it. Yes, I really do. It definitely is a rewarding career for me.
I love my job. I love coming in every day and doing what I do.
When you get in, the people are always friendly, and not just this department, in the building. Of course, the people who I work with, the nurses, my supervisors, they always treat me with respect, and it's always a fun place to work, and there's always something going on, and people are there for one another. And it's good to work here in this environment, and you can't ask for a better place to work.
At the end of the day, feeling like you made a difference, that's what I like about my job.